Hi there, this is Lindsay Lopez from Southeastern Physical Therapy. I'm joined today by Eva Marie McEwen, a physician's assistant with Tidewater Orthopaedics. Eva, thank you so much for your time today. How are you?
I'm doing great. Thanks for having me.
Awesome. So I would love to talk with you a little bit about plantar fasciitis. What exactly is it?
Sure. So first, I definitely want people to know that this is a common problem. In fact, it's the second most common, well, among the top two most common causes of heel pain. So before explaining exactly what it is, let's first discuss some of the anatomy involved so we can get a better understanding of why we call it that. So in the world of foot and ankle, when you're looking down at the foot, the portion that you see is what we call the dorsal side. And then what runs underneath is the plantar side. So you have a very thin but strong layer of band of tissue, which is called a fascia, that runs from the heel all the way to the toes. And its main job is to support the arch. So when that fascia gets inflamed, bring in the itis, that's why we call it plantar fasciitis. So it's inflammation of that tissue.
Okay, so how do you diagnose that? How do you diagnose plantar fasciitis?
So there are some imaging that, some forms of imaging that can help pick this up, but quite honestly, this is something that clinicians predominantly rely on, number one, the patient's history and their actual exam to diagnose this. While there are distinct symptoms associated with plantar fasciitis, for the most part, I'm able to diagnose this on a pretty routine office visit. So let me provide some of the presenting symptoms and triggers that I hear most often from my patients. So they describe an intense, sharp, stabbing pain, especially with that first step getting out of bed in the morning. That's probably one of the most common things that I hear. And I also get a lot of patients that state pain when they're getting out of the car after a long period of sitting. Other things from athletes, I hear, oh, well, I used to be a runner, but I took a break. I started back recently, and now I have this throbbing pain in my heel. Another common one is I have lots of patients who work on concrete floors all day, whether it's retail or in an OR. I also treat lots of shipyard workers, and they're climbing up and down ladders, lots of steps, and on steel decks. That's a really common one too. So basically, these patients tend to have a lot of tenderness on their exam when they are flexing their foot upwards. It really stretches that fascia, and when I press on that heel, it really aggravates the problem.
Okay. So what is involved in the treatment of a patient with plantar fasciitis?
So plantar fasciitis is treated non-surgically. And for the most part, it can resolve over a period of time, but it can be a really long time, like sometimes upwards of 12 months. And that's a long time to have a lot of heel pain going on because it can be really intense. And for some patients, quite frankly, it can be debilitating. But there are some rather simple techniques that you can do at home and things that we can utilize here in the office and at physical therapy to help alleviate some of the symptoms. So first, I would say recognize your trigger. If you know that running or a high aerobic step class is an aggravating factor, then you might need to rest from that activity and take a break. Sometimes triggers like standing on an OR floor because that's your job, that's unavoidable. So what I would say next is stretching is so important. And, you know, there's definitely lots of techniques that physical therapy can help with. There's a technique called Graston that really helps work out some of the inflammation. And there's also some taping techniques that a lot of people have had relief from. But as far as some simple techniques that you can do at home, I would recommend to all my patients with plantar fasciitis to be stretching daily. One of the best ones is when they place their hands up against the wall and they take their affected leg and they step back into almost like a lunge against the wall, and to really feel that calf muscle pull, and to hold it for about 10 seconds and then stand back up, and to go ahead and do that over the course of a couple of times. And you can do that all throughout the day too, especially after those long periods of sitting when you stand up and it hurts even more. Another great stretch, and I like to recommend this one even before you get out of bed, is when you sit on the side of the bed, cross your legs and take the affected leg and put that on top. And then you simply grab your toes and pull them up towards you, really getting a nice deep flexion stretch of the foot and really working that fascia out. And I would recommend doing this throughout the day as well. I have patients who I tell them you should be doing these stretches upwards of 3 to 4 times a day. So stretching is a great technique to alleviate this. I would also say that ice goes a long way in treating plantar fasciitis. There's a long-standing tip of freezing ice water bottles and rolling your foot over that water bottle. I even tell some people during their lunch break to roll their foot over a tennis ball, because it might not be easy having a frozen water bottle accessible. And then I would say too that keep in mind this itis, this plantar fasciitis, it is an inflammatory process. So taking an anti-inflammatory can sometimes provide people with relief. But I would caution patients here, because we never want anyone taking anything like Aleve or Motrin on a daily basis for a long period of time. So definitely check with your doctor first before you start taking those regularly. I would also say that there are a lot of products on the market. I mentioned earlier, this is really common. So, there's lots of companies who have kind of capitalized on products associated with plantar fasciitis. There's everything from heel cups to special types of socks. There's also orthotics. I tell patients, your feet are a worthy investment. And if you want to go with the route of orthotics, I would start on the inexpensive side. See if you get some relief. If you get any relief at all, then it might be worth investing into some custom orthotics that you can take from shoe to shoe. And then the last thing I would say is when it comes to this category of orthotics is night splints. I mentioned earlier that one of the telltale symptoms of plantar fasciitis is when you take that first step out of bed in the morning and it hurts so bad. It's really painful. When we sleep at night, our foot is usually pointed down. So that fascia, it's not being stressed. But when you take that first step in the morning, that's what induces that exorbitant amount of pain. So when you sleep with a night splint, it's actually stretching that fascia at night while you're sleeping. And this one is kind of not a well-known treatment, but chiropractors can actually help with plantar fasciitis too. Sometimes they have special pulsatile tools that can help work out the inflammation, and some of them can actually do manual adjustments as well. As far as kind of the last treatment that I reserve when we've exhausted all of these conservative methods is a steroid injection into the heel, which for obvious reasons, most people try the other conservative methods first.
Okay. So you kind of alluded to some, in your previous answer, but how can a person prevent plantar fasciitis? Is there anything that they can do to limit their risk?
Sure. So again, first, I would know your triggers. Sometimes plantar fasciitis, along with many other, diagnoses, they're simply spontaneous. There's not really anything to attach it to. But if you can identify your triggers and if possible, avoid them, that's honestly the best way to avoid plantar fasciitis. I would also say stretching daily. I hear a lot of patients say, but I'm so active. Well, even active folks who work out regularly, their muscles get tight. So keeping those calf muscles stretched and incorporating daily stretches is a good way to prevent it. And I would also say invest in supportive shoes. I see so many patients that are walking around in foot pain, and some of it is directly related to just poor support. Plantar fasciitis tends to be associated with patients with high arches. So if you know that you have a high arch, you definitely need to invest in a good pair of supportive shoes.
Okay. So Eva Marie, where do you typically see patients?
So right now I see patients at our Hampton location, that is at 901 Enterprise Parkway, we're Suite 900. And I also work out of our Williamsburg location, which is at 4037 Ironbound Road.
Okay. How can a patient set up an appointment with you guys?
So it's as easy as calling. The patients can contact 757-827-2480. And they can also schedule online as well. So they could go to tidewaterortho.com to schedule there.
Great. Well, thank you so much for your time today. It was a pleasure speaking with you and learning a little bit more about plantar fasciitis. I hope you have a great day.
Of course. Thank you so much.